The World Economic Forum put a number on something governments have ignored for decades. Aging badly is expensive and fixing it is cheap. A new report from the WEF and Marsh, released as summer Davos opens in China's Dalian, makes a blunt case. Simply home safety environments, improvements, physical activity programs and access to hearing aids could prevent nearly 400 million falls, 8.5 million new diabetes cases and 2.4 million dementia cases by 2040. The payoff: over $5.8 trillion in healthcare savings and $645 billion in productivity gains. Break down the math and the asymmetry is stark. Home retrofits, rug tape, stair lighting and grab bars could prevent 400 million falls and deliver more than $5 trillion in healthcare savings against less than $400 billion in upfront global investment. That's roughly a 13-to-1 return for fixes that cost less than a hotel minibar. The diabetes case is similarly lopsided. Community physical activity programs costing $1 to $40 per person. It could prevent 8.5 million new type 2 diabetes cases globally, returning over $125 billion in productivity gains and $85 billion in healthcare savings. While China alone could add 16 million healthy years for people over 50, hearing aids close the trifecta. Fewer than 20% of the world's 400 million people with hearing loss have access to hearing aids, despite the now well-established link to dementia risk. So why is it not happening at this scale? The report's real finding is not medical, it's institutional. Governments and businesses manage health finances and labor participation separately, leaving trillions on the table. And the gender cost is explicit. A year of caregiving combined with the gender pay gap cut, it can cut women's retirement savings by 24%. This lands at a politically loaded moment. The IMF has just trimmed global growth forecasts to around 3.1% for 2026, citing geopolitical risk. Against that backdrop, a 13-to-1 return sitting unclaimed because of bureaucratic silos isn't just a health story. It's a policy failure with a price tag. Well, our correspondent Dharamjot Kaur has sent us this report from Dalian, China, with more details.
Health is wealth is a statement that we have heard far too long, far too often. But here in Dalian, as summer Davos unfolds with many stakeholders and state leaders present over here, the World Economic Forum is making a case for bringing the two together and doing so in an economical manner. Now, this report talks about low-cost, effective measures and policies that can benefit global healthcare systems to the tune of almost $6 trillion US, and it can also increase productivity for economies across the world by more than $600 billion.